Artifact introduced during autopsy. Air in the blood vessel. Pulling of dura in the sagittal line will cause the air to enter the blood vessel at the top of the brain. Similarly, air may enter into the veins of the neck during the reflection of the skin. This may lead to erroneous diagnosis of air embolism. Skull fractures. Fractures of the skull, usually in the middle fossa, may produce due to partial sewing and forceful pulling of the skull cap, or due to partial sewing and then using chisel and hammer to loosen the skull cap. This may produce additional fracture and may cause extension of already present antemortem fracture. In such cases, differentiation between antemortem and postmortem may become very difficult. Visceral damage. Rough handling of the brain during removal may produce tear of the midbrain. Rough handling of the liver during removal may produce tear of the diaphragmatic surface, which simulate antemortem laceration. If the neck structures are pulled too hard during autopsy to draw out of the thoracic viscera, they may be torn, and also transverse intimal tear may be produced in descending aorta. Extravasation of blood. In case of suspected cranial injury, the body should be opened and the cardiovascular system decompressed by opening the heart before the head is opened. If blood has not drained from vessels of the head, damage to the dura and dural venous sinuses on removal of skull cap may lead to an escape of blood in the subdural spaces, simulating an antemortem subdural hemorrhage. Large blood vessels may be cut while opening thoracic and abdominal cavity. Considerable amount of blood escape into the pleural and peritoneal cavity. Air may be drawn back into circulation and enter the pulmonary vessels and give a false impression of air embolism. During autopsy, the handling of organs and incision of the vessel may result in extravasation of blood into the tissues. The removal of the neck structures en bloc, as in routine autopsy, may produce artifact in the neck tissue which resemble bruise in case of throttling. Therefore, the neck structure should be dissected in situ and in a bloodless field. Fracture of the hyoid bone. When the tongue and neck structures are firmly grasped and pulled up while removing the neck organs, the hyoid bone and thyroid cartilage may be fractured, especially in older person. Surrounding the fracture region, hemorrhages are not seen. Osseous bone union between the segments of the hyoid may be unilateral. Such unilateral mobility or artifact may be dissection may lead to erroneous impression of antemortem fracture. Injury to the blood vessels. While dissecting the neck structure, the toothed dissecting forceps is used. It may damage the intima of the carotid artery, which resembles a tear as seen in case of strangulation. Toxicological artifact. There may be introduced due to contamination of viscera with the stomach content during autopsy, or by pulling all the organs in one container, or by using contaminated instruments or containers. Faulty technique in collecting the sample, faulty storage or use of preservative. So, toxicological artifact. Injury to the blood vessels. If toothed dissecting forceps is used, a fracture of hyoid bone when we pull that, and also this extravasation of blood into the surrounding tissue, visceral damage, and air in the blood vessels and skull fractures. Thank you.